How do Fimbriae cause tubal factor infertility? Imagine the tiny finger-like projections at the end of your fallopian tubes called Fimbriae. These delicate structures are like the gatekeepers of fertility, guiding the egg from the ovary into the tube for fertilization. Their job is crucial because they gently wave and reach out to catch the egg as it's released during ovulation. When they work properly, they help ensure the egg enters the fallopian tube smoothly, starting the journey toward possible conception. However, damage or scarring to the Fimbriae can interfere with this process. This damage often results from infections like chlamydia or gonorrhea, which cause inflammation and lead to scarring around the Fimbriae. When scar tissue forms, the Fimbriae can stick together in a process called agglutination, making it impossible for them to pick up the egg. This means the egg might never reach the fallopian tube, preventing fertilization from happening naturally. In more severe cases, the opening of the Fimbriae can narrow or become blocked, a condition known as fimbrial phimosis. When this happens, the egg cannot enter the tube at all. Sometimes, the tube may even fill with fluid, creating a hydrosalpinx, which is a swollen, fluid-filled tube that can further block the egg's path. This swelling can prevent the egg from entering the tube, making conception unlikely without medical intervention. Fimbrial damage is a common cause of tubal factor infertility, which accounts for about a quarter to a third of all female infertility cases. Many women with damaged Fimbriae do not experience symptoms, and the problem is often discovered during fertility evaluations. Diagnostic procedures like imaging tests or laparoscopy help doctors see the condition of the tubes and Fimbriae directly. Endometriosis is another factor that can harm fimbrial function. It causes inflammation and adhesions that can stick the Fimbriae to surrounding tissues, impairing their ability to catch the egg even if the tubes are open. Additionally, infections and inflammation can damage the tiny cilia lining the fallopian tubes. These cilia are responsible for moving the egg toward the uterus, and when they are damaged, the transport process slows or stops altogether. This cellular damage can persist even after the infection clears, further reducing fertility chances. The extent of fimbrial damage influences pregnancy outcomes. Mild damage might still allow for conception, especially with surgical repair, but severe damage often results in very low pregnancy rates. For women with significant tubal damage, assisted reproductive techniques like in vitro fertilization can bypass the need for functional Fimbriae and fallopian tubes altogether. In summary, Fimbriae cause tubal factor infertility mainly by becoming scarred or blocked, which prevents the egg from being captured and transported properly. Infections, endometriosis, and inflammation are common culprits behind this damage. Understanding how these tiny structures work helps us appreciate the complexity of fertility and highlights the importance of early diagnosis and personalized treatment options. If you suspect tubal issues, consult a healthcare professional for proper testing and guidance tailored to your unique situation.